Let's switch live to Oslo now. Dr Mads Gilbert is going to join me now. He's a professor at the Clinic of Emergency Medicine at the University Hospital of North Norway, and he has worked over extensive periods in Gaza, so he knows full well the suffering that has been endured there. So all these people, as we know, thousands of patients need to get out of Gaza for emergency treatment. Who is going to be at the front of that queue in terms of necessity? Who are the most in need?
Well, you're absolutely right. The number listed in the last UN report is more than 18,500 patients waiting in Gaza to go abroad for essential, often life-saving medical treatment. Among these 18,500, there are 4,000 children. So you would believe that, of course, the most dire needs and the children should be given priority. But with all these obstacles and this chokehold that Israel is holding on Gaza, we will not know. And let me remind your viewers that 1,300 patients have died waiting for treatment abroad. And this is, of course, reflective of the widespread destruction of the Palestinian healthcare system, despite the heroism of the Palestinian healthcare workers. And don't forget, 1,700 have been killed. They still work in the hospitals and the primary healthcare to save whatever can be saved. So the situation is extremely difficult, also from a medical point of view.
The situation you've just described, and in conjunction with our correspondent saying it might take months for all of those sick people to get out and get treatment, I would imagine every hour, every day could make the difference between life and death for somebody, which means someone has to make the choice. You go, you don't. That's an awful decision to make. Who's going to make that?
Well, nobody knows. What we know is that Israeli occupation forces have a very tight grip. Don't forget that they have reoccupied more than 60% of the territory of Gaza. So both the in and outs from Erez and from the east side, and as you have been discussing from Rafah, is virtually closed down. And don't forget also that Israel issued an order to 37 international well-reputed NGOs to leave Gaza. And these NGOs were also an important asset for the prioritization of the patients to leave. So I don't know what is going to be of this, but what we do know is that people are dying waiting for medical support and medical treatment. And in addition, the living conditions in Gaza are extremely difficult now. Don't forget that 81% of all structures in Gaza are destroyed, and 1.3 million people are living in shelters. It's winter now. Up till now, 11 children have died from cold. They have frozen to death, while tents and blankets and supplies are stuck on the outside of Gaza because Israel do not fulfill the obligation in the ceasefire agreement to fully open all entries for humanitarian support. So from a medical point of view, this is a wholly preventable, engineered disaster, engineered by Israel, as we know. So this is going from a very active genocide to a slow motion genocide, where the lack of food, water, as we heard, medical supplies, medical treatment facilities, and the pure basic living conditions is killing people in Gaza as we speak. And also don't forget that since the ceasefire, 492 Palestinians have been killed by Israeli gunfire and bombing in Gaza, and 1,400 injured. They are also in need of medical treatment, the injured.
I mean, the imperative thing is to stop more loss of life. If medics are allowed to come in, with some kind of equipment and medicine, what kind of difference could they make helping people still inside Gaza?
Not very much. At the current site, at the current time, only 31 emergency medical teams are in Gaza, according to the UN, and less than 100 international medics. So the Palestinians are, as they have been throughout the last 2.5 years, relying on their own capacities. But of course, letting in external medical professionals and journalists would open the eyes of the world to what is going on in Gaza. Still, it's a black curtain drawn on Gaza because the atrocities in Gaza are so horrible that if the world got to know it, there would be widespread sanctions directed at Israel. So we have to remember that drip feeding some humanitarian support into Gaza is not solving the root cause, which is the occupation, the siege of Gaza, and the expanded genocide in Gaza.
Mads, always a pleasure to get your insights. Thank you very much, my guest, Dr. Mads Gilbert from the University Hospital of North Norway.